Yeah, okay. Good morning. This is Dr. Arun here. So, what we are going to learn today is the difference between a male hairline and a female hairline, and also how do you draw a hairline for a male with a genetic pattern baldness. So, if you see this patient, he's a young guy, but then he has got almost like a grade 4 androgenetic alopecia. Okay, so he has lost his hairline, typical M-shaped pattern, and also if you see there is reduced density in the vertex area. So typically it is a grade 3 or I would say grade 4 androgenetic alopecia with reduced density all over. So what we are going to be doing is we are going to be doing 2 sittings of hair transplant, and we are trying to figure out if you can just fill it as much as possible. Keeping in mind that in future, in maybe next 4 to 5 years, he might require another session of hair transplant because it's a genetic pattern baldness, and what happens is you start losing this hair which is already there in a while. So first thing when he comes is diagnosis. We have diagnosed it as androgenetic alopecia grade 4. Then we are also going to tell the patient, explain the patient that he might require another session of hair transplant later. So we are not going to be concentrating on the vertex area, we will be just concentrating on the frontal area or the hair area, because this is what is important. From an aesthetic point of view, this is what is important. Now, how do you differentiate between a male hairline and a female hairline? As we have been talking for a while, a male hairline always typically goes back like this, and you create a typical M-shaped pattern here, an M-shaped pattern. But while in a female, we draw it something like, what we call it as a heart-shaped face. So the hairline is something like a heart shape here, and this goes down like this and comes like this. So typically what happens is the temporal peak for a male, it is sharper and more prominent, while for a female, it is not very sharp, it's not very prominent. It is like a S-shaped curve, like a lazy S-shaped curve. Apart from that, you also have a widow's peak, which is I mean 80% of the times a female hairline would have a widow's peak, or called as the central mound. But for a male, it's up to you how you want to do it. Now, the most important part about a hairline is basically when you're doing it should not be a straight hairline. Always make it as a point that it should be, kind of haphazard to have a natural appearance. Alright. Now, what we are going to be doing is we are going to be drawing a hairline for him here so that we can draw it. Now, the first thing is basically to mark the mid-frontal point. So, the mid-frontal point is about 6 to 7 centimeters from the glabella. Some people take it from the mid eyebrow point, but I think a glabella would be a point. You can always think. Now in this situation, if I would kind of mark it from here, it's exactly at 6 centimeter here. So I wouldn't bother now to change this hairline because I don't want to go up from here. I mean, it is good because knowing that he's going to have recession, let me not be very aggressive. Okay, so neither I would like to lower the hairline, neither I would like to take it up. So this is going to be my mid frontal point. So this is my midline, this is my midline, okay, and this is going to be a mid frontal point. Okay, so my things will start from here. All right. Now the second thing is you have to understand the frontotemporal angle. So the frontotemporal angle is the line which comes here from the mid frontal point and comes and joins the lateral hump here. So this is going to join the lateral hump here. So this is going to be my line which I am going to draw like this. Now this can change according to the patient's face, according to the patient's requirement, and according to the patient's facial appearance and age. Age is also very important because when we are young, we don't want to put a hairline which is going very up, or when the patient is old, we don't want to bring it very low. So we'll try and put it here, and being very conservative. Sometimes what happens is the patient's face is longer and you don't want, your grafts are less, you would like to, kind of bring this still further so that you can save some grafts. That is also another very important thing. You need to save grafts for the other area. So this is going to be my line which comes here. This comes here and joins the. So when we speak about the hairline, actually hairline is just not a line. As I was telling you, it's a zone. We are talking about a zone. So it actually contains 3 parts. One is basically called as a transitional zone, which is basically a 0.5 to 1 centimeter area a 0.5 to 1 centimeter area here, which is going to be less dense than the other parts. Okay, so this is going to be my transitional zone, or called as the TZ. Okay, so this is going to be my TZ. So TZ is going to be one area wherein you are going to be putting single grafts. All the double, triple follicular units should be kept behind. So this, to give you a natural appearance, you need to do it as a single grafts, less dense, about 0.5 centimeters, which I have kind of marked. About 0.5 to 1 centimeter is going to be there. Behind that is going to be your defined zone, which is going to be the maximum density here. So this is going to be my defined zone. Okay, now this area could be about 2 centimeter, 3 centimeter. Now what is important here for me is also to give good density into this area, which is called as a frontal tuft. So this is going to be my frontal tuft. The frontal tuft is an area which is just in between, and if you see somebody from the front, and if you have a good frontal tuft, you wouldn't actually feel that the patient is very bald. So giving a good density to this frontal tuft again is of prime importance for me. So transitional zone, defined zone, and frontal tuft, FT. And beyond that, once you have done this, depending upon how much of the grafts are available, what I'm going to do is basically I'm going to fill this area. So this is going to be my another area which I am going to fill in as much as possible. Now what I am going to be doing is, this is not going to be straight for me. So what I am going to be doing is basically I am going to be giving irregularities, which is in form of macro and macro irregularities. See this? So what I am going to be doing is I am going to be giving some irregularities here so that it looks more natural appearance. Okay. Now, as I was telling you, you could also draw this hairline in form with this thing. So this is my mid-frontal point. You see this? Yeah. So maybe when you are drawing it with this, you would see that this is slightly at a lower. So you could do this. See, as long as you can draw it with your hairline, with your hands, free hand, it is good. If you can't, you can use a laser. So it just kind of marks and gives a more straighter appearance. It's more or less it is the same thing here. Alright. So this is how we are going to be doing this thing. Apart from that, what is very important here is to define a temporal peak. Now, what I am going to be doing is defining a temporal peak here. So this is going to be my temporal peak. As I've always told that a temporal peak, a good temporal peak, gives a more youthful appearance. If somebody who has lost the temporal peak, he would not have the youthful appearance doesn't really come. So what I'm going to be doing here is basically giving a good temporal peak here, a good temporal peak here. So he has a little, but what I would like to do is to increase the temporal area here. So this temporal peak is going to give him a good definition, and he's going to look younger. Otherwise, it looks like a kind of a wig which is put there because the patient doesn't have temporal peak. So this is what I'm going to be doing here. So what we will do is, yeah, this looks nice, and then the second step is we're going to be trimming this, and we are going to be defining the donor area. So I'll come back and explain you how to kind of decide the donor area, but this is how we design a hairline. Okay guys, if you have any queries, please feel free to get in touch with us.